Tay-sachs disease. What is it? Tay-sachs disease is a rare disorder passed from parent to child. It's caused by the absence of an enzyme that helps break down fatty substances. These fatty substances, called gangliosides, build up to toxic levels in the child's brain and affect the functions of the nerve cells. History. In 1881, Warren Tay, a British ophthalmologist, observed a cherry red spot in the retina of a 1-year-old child's eye with mental and physical retardation. Later, in 1896, Bernard Sachs, an American neurologist, observed extreme swelling of neurons in autopsy tissue from affected children. He also noted that the disease seemed to run in families of Jewish origin. Both physicians were describing the same disease, but it was not until the 1930s that the material causing the cherry red spot and neuronal swelling was identified as a ganglioside lipid, and the disease could be recognized as the inborn error of metabolism. Symptoms. There are 3 types of Tay-sachs disease: classic infantile, juvenile, and late onset. Classic infantile symptoms usually occur when the child is about 6 months old. It starts out with slow development and then a gradual loss of skills, such as coordination, swallowing, breathing, and reduced vision. By the time the child has reached 2 years of age, they may experience seizures as well as loss of mental and muscle functions. Juvenile symptoms begin to occur sometimes during childhood. Early symptoms include slow speech, muscle weakness, swallowing, and breathing difficulties. Later symptoms include a decline or loss in the ability to walk, eat, and communicate. Children in this stage are very prone to respiratory diseases, pneumonia, and seizures. Adults with late onset may have first showing signs during their childhood, such as speech impediments or just not being very athletic or strong. Symptoms that occur during adulthood start with muscle weakness and mental health problems. These then progress into a decline in mobility and breathing, plus swallowing difficulties. Is it common? The disease is very rare in the general population. However, in Ashkenazi Jews, French Canadians of southeastern Quebec, the Old Order Amish of Pennsylvania, and the Cajuns of southern Louisiana, the condition is more common. Inheritance. Tay-sachs disease affects someone who inherits 2 copies of an altered gene from their carrier parents. Carrier parents have a 1 in 4 chance of having an affected child, a 1 in 2 chance of having a child who is unaffected, and a 1 in 4 chance of having a child who doesn't carry any of these altered genes. Diagnosis. Tay-sachs disease is diagnosed with simple blood tests that test the hex A levels in blood. A DNA test can also be administered to determine whether or not a person has Tay-sachs. Children with infantile Tay-sachs often are diagnosed by a characteristic red dot found on the retina of the eye. However, this is not usually found in those with juvenile and onset Tay-sachs. Causes. The disease has an effect on chromosome 15. It is caused when a person is born with a mutation in the hex A gene, the gene in your DNA that provides instructions to create the enzyme beta-hexa. People born with the disease are born without or with very reduced levels of beta-hexa enzyme. This causes the lipid GM2 ganglioside to build up in cells, which causes damage to the cells over time. Treatment. As of now, there is no treatment for Tay-sachs. Some support of treatments may include massage therapy and management methods to make life more comfortable for those living with the disease. Proper nutrition and hydration, along with medicine to help control seizures, also has a great effect on children living with the disease. Children may eventually need a breathing tube because it's important to keep their airway open. In summary, Tay-sachs is a rare inherited disease. It is a metabolism disorder that causes too much of a fatty substance to build up in the brain. This buildup destroys nerve cells, causing mental and physical problems. resulting in the symptoms of Tay-sachs.